Hello, I'm Dr. Stuart Firsten. This video demonstrates therapeutic procedures that can provide relief for common conditions including neck pain, headache, muscle tension, and related disorders. Manipulation or adjustment of the cervical spine may be performed with the patient lying on their back. The head and neck are gently supported and positioned. A carefully controlled impulsive force is then applied. Other treatments may include traction performed by hand, mobilization, myofascial release, trigger point therapy, and deep soft tissue massage. By taking into account the normal biomechanics, the neck can be thoroughly and comfortably palpated, mobilized, manipulated, and adjusted. Manual therapy techniques are generally appreciated and well tolerated by most patients. They should only be provided by qualified practitioners. Such procedures serve to restore joint mobility, relax muscles, improve circulation, decompress impingement, and reduce irritation to nerves. Published medical research studies now indicate that risks associated with cervical manipulation are extremely low.